Developing a therapy for a disease like Rvcl is not easy, but we are determined to find a solution for this disease, and we are now closer than we ever were before. Rvcl stands for retinal vasculopathy with cerebral leukoencephalopathy. It's a blood vessel disease. It can impact the brain, the eyes, the liver, the kidneys. Patients go from completely healthy to having a deadly disease.
Until recently, being diagnosed with a rare genetic mutation that causes Rvcl was a death sentence. But now, a team of researchers including Nobel Laureate Dr. Drew Weissman and Dr. Jonathan Miner are working on a technology that could radically transform the future of the disease and those living with it.
The technology we're using is CRISPR-based. The solution in Rvcl is to fully correct the abnormal TREX1 gene. So one might think, well, why don't we just delete the abnormal gene like has been done in these other diseases? And the answer is that we can't.
Using traditional CRISPR methods to cut the abnormal gene creates new mutations that would also cause disease. So researchers are now using a new technology that not only cuts but repairs the mutation by inserting the correct piece of DNA.
What's being used for Rvcl is known as a prime editor. CRISPR just cuts. The prime editor has other components that cut, remove, replace, and put the right letter in.
Their challenge now? How to deliver the correctly edited section of DNA to the right genetic sequence of cells through the body.
We're using RNA and specialized delivery vehicles. They're actually the same things that are in the COVID vaccines to fix the broken gene.
The key innovation developed by Drew Weissman, for which he and Dr. Carrico won the Nobel Prize, was the discovery of a way to modify RNA so that it could be used as a drug.
Besides a gene therapy to fix the mutation, researchers are developing personalized medicines, custom-designed small molecules that block the mutated protein in Rvcl.
There's an almost limitless number of potential compounds, but finding the one that works is like finding a needle in a haystack. To achieve this, we're using the most cutting-edge technologies.
It isn't just us. You need a lot of different collaborators all over the world.
They're working around the globe, focused on one goal: to save lives.
Thanks to the support of the Clayco Foundation and our wonderful collaborators around the world, we've been able to move faster and faster.
A path to revolutionizing treatment for countless genetic diseases is opening. Every advancement is crucial, not just for those stricken with Rvcl, but for the future of medicine itself.
The hope is it can be used for many different genetic diseases. That's why the support is so important. We're fixing Rvcl, but that knowledge will help with thousands of other diseases.